Cindy, what brought you here today?
Well, I'm the new executive director of an organization called Georgians for a Healthy Future, and we're working on healthcare issues, so I'm following national health reform very, very closely.
Where do you stand right now?
Well, I definitely think we need reform, and I'm excited about it, and I hope that we can when Congress gets back in session, I hope that we'll see some good action. I think that there's a lot of meaningful reform in the bills that are out there now, and a lot of good elements that will really improve things.
Okay. What brings you here today?
Well, I came to support healthcare reform and to see Congressman Scott. I met him. I was part of an AARP delegation to D.C. and we had a very good meeting with him, and so I wanted to come to support both healthcare and the congressman because I know he's been beaten up some at these town hall meetings.
Okay.
And I wanted supporters to get out there for him.
Okay, great. Thank you. What brought you here today?
I'm very interested in this issue. The vitriol, the strong reaction of people that I see on the news has piqued my interest, gotten me to realize that people who don't have such strong reactions, those of us I think who are more in the middle on these kinds of issues, need to stand up and voice our opinions and share them with others and help the conversation to become more of a stable, give and take type of conversation rather than bullying, yelling, and screaming.
Okay. So you're interested in this just because you want the conversation to move to the middle?
Yes, I do. Yes, I do. I'm tired in our society of the extremes dictating which way we go on dealing with very important issues, and this, I think, is a very crucial one for us.
Okay.
Good morning. Welcome to AARP's Town Hall meeting to talk about health care. I'm Ken Mitchell. I'm the State Director for AARP Georgia, and I want to welcome you here this morning. Clearly, with the weather today, you all have braved the weather and come out to be a part of this. I'd like to begin today's meeting, though, by everybody standing and saying the Pledge of Allegiance to America. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Before we proceed with the program's outline, let me take this opportunity to recognize any elected officials who have joined us today. Would elected officials in the room please stand?
Good morning.
Good morning.
I'm State Representative Don Wicks. This is not my district, but this is my old hometown. So
Okay, very good. So we're glad to have you with us today. And again, that's State Representative Don Riggs.
Wicks.
Riggs. Oh, I'm sorry.
Yes, thank you.
Okay. Anyone else? Okay. Your participation in today's town hall meeting is your chance to hear from and ask questions of our special guests and to get the latest information and efforts to reform healthcare at the national level. And we have tried hard to get people that really know their stuff today and that are going to be able to talk about the issues. Since healthcare is so big yet so personal, it is 1/6 of our nation's economy, and the solutions are complicated and sometimes confusing. Each of us owes it to ourselves to better understand these issues and decide about these tough issues. AARP is fighting for our members, 50-plus Americans, to lower drug costs and strengthen Medicare, protect your health care choices, end discrimination by insurance companies, and guarantee stable, affordable coverage. Through the debate, AARP wants to help you cut through the noise and find the facts so you can decide for yourself what healthcare reform means to you and to your family. Now let me introduce today's town hall meeting participants. First, David Scott is a U.S. Representative for the 13th District of Georgia. He is serving in his 4th term representing portions of 6 counties: Cobb, Clayton, Douglas, Fulton, Henry, and DeKalb. Congressman Scott sits on a number of influential committees, including the Financial Services Committee, the Foreign Affairs Committee, the Agriculture Committee, and the NATO Parliamentary Assembly. Congressman Scott is providing leadership in strengthening our economy, improving health care, enhancing education, and fostering energy independence. Prior to his election as a U.S. Representative, Congressman Scott served in the Georgia House of Representatives from 1974 to 1982, and in the Georgia Senate from 1983 to 2002. Congressman Scott received his BA degree from Florida A&M University and his master's MBA degree and honors from the Wartburg School of Finance at the University of Pennsylvania. Also joining us today is Dr. Joyce Payne, a member of AARP Board of Directors. Currently, she serves on the Board Audit and Finance Committee and is chair of the board of the AARP Foundation. Prior to retirement, Dr. Payne was Vice President of Human Resources and Minority Programs for the National Association of State Universities and Land-Grant Colleges. In that capacity, she was responsible for congressional and federal relations and developing initiatives that contributed to the advancement of public historical black universities. She previously was president of Global Systems, Inc., and held positions in the White House Conference on Families and the President's Advisory Council on Women's Education. Dr. Payne served as chairman of the Board of Trustees of the University of the District of Columbia, coordinated congressional relations for UDC Coalition, and chaired the Political Action Committee for the DC chapter of the Coalition of 100 Black Women. She was appointed to the U.S. Department of State's Council on Equality in the Workplace by former Secretary Warren M. Christopher and served on the Kellogg Foundation Task Force on African American Boys and Men. Dr. Payne founded the Thurgood Marshall College Fund, and which she considers her greatest achievement, and serves as chairman of its nominating committee today.